So let's start. How will you manage the patient of the oral submucous fibrosis? Very important topic. Let's start. Bismillahirrahmanirrahim. Okay, so basically, what happens? How will you always remember in management? You will take the history, clinical features, and then you will come across. But there is no okay. So very important point. Then you will give the modifications, that how will you treat the patient in that. Okay, very important point. So number one is the education. You will educate the patient about the oral submucous fibrosis, that in some you will tell the patient that this happens in this condition. You will have trismus, lockjaw, difficulty in speech, difficulty in eating, etc. Then you will tell about the risk factors, that by taking the tobacco, or by betel nut chewing, areca nut chewing, nutrition deficiencies, genetic factors. These are the risk factors, or due to which the oral submucous fibrosis occurs. Then you will give oral hygiene instructions to the patient. Definitely habit intervention, those habits which the patient have told you in the history. Okay, if the patient is taking definitely any areca nut, you will tell her to stop it. If the patient is taking betel quid, you will stop it. If the patient is deficient, you will give her some vitamins, etc. And the most important is the follow up, very important. Then of course, what I have told you, that stop the betel quid and areca nut, at least the remover of the tobacco from the coit, avoid spicy food, very important. Healthy diet to correct the malnutrition. Definitely you will give this patient okay, this modifications. Proper oral hygiene, you will tell the patient. Okay, very important point. Then you have corrections of anemia deficiencies, which I have told you. And then follow up, regular follow up examination. Then if it is mild, and this is reversible, if less than 35, if less than 35, it comes in class 2. So you will tell the patient stop the habit, stretching exercises, that the patient to prevent its mouth closure. Okay, intralesional agents, you will give some intralesional agents. You will give the steroid dexamethasone injection, which is 4 milligram, which has a Hylase 1500 international unit in 1 ml. Then you will give the placental extracts of 50 micrograms, hyaluronidase injection 150 microgram, interferon, which is patient has deficiency, which is antifibrotic. You will give 50 microgram, and 2 times weekly for 8 weeks. Okay, so always remember, you have what have dexamethasone 4 milligram, hyaluronidase 150 microgram, and interferon, which is 50 microgram, uh, uh, twice weekly for 8 weeks. Okay, then you have moderate. So what has happened here, there is they have told you the range of mouth opening. So what happens in mouth opening, this is basically, you have a class, you have this is class, you have this class class 2, and this is class 3. Okay, stop the habit again, what is, and then you will increase the amount of interferon, which is 100 microgram intralesional, uh, twice weekly for 8 weeks, and then vigorous activities again, and stretching exercises. Okay, severe cases, if it is less than 15 milli, which is a stage 3, you have actually millimeter mouth opening. Stop the habit, increase the interferon, which is 100 microgram pre and post operative. Then you have vigorous exercises to prevent the mouth closure. Then surgery. If the patient is very severe, so what you will do? You will do fibrotomy. Fibrotomy, you will remove the fibrous tissue by reconstruction, either with the skin graft, Yeah, splint thickness mucosal flap, which is which flap has been used here. Very important point in your competitive exam, in your viva, in your this is very important point in surgery, that when you do a surgery, so which flap you will place. So it is a major delta pectoral forehead. So very important point, it is a major delta, you have pectoral forehead. Very important point, very important point. That for splint thickness of mucosal flap, which flap it is major delta pectoral forehead. For tongue flap, then there's a tongue flap you can give also. Then you have nasolabial palatal flap, you can give temporalis flap, which is very thick muscle. Free flap, radial foramen you can also give, but this is very important, you should know this is the major delta pectoral forehead actually. Then the prognosis, there is a risk of malignancy, which we have told it is 4.6, like you have 6% to 8% over 10 years. Long follow-up is very important. Recently what happens when you have bilateral, so you do what it is, chronodectomy has been reported. When you have bilaterally both the mucosas, you removed it, you remove the chronoid processes, then it's yeah, it has been told here. Okay, then differential diagnosis, amyloidosis, amyloidosis. Then you have generalized fibromatosis, scleroderma, lichen planus, anemia. Very important. Okay, so special concerns of the patients, that the ulcer is non-healing. It undergoes red changes. You have burning sensation of the mouth, means there's a non-healing ulcer from almost 2 weeks. There's a continuous red changes, burning sensation with the spicy food. Exophytic mass is present in the mouth. Lump or swelling in the neck. Difficulty in chewing, swallowing, speaking, hearing in the fourth speech, or the speech was in the fourth, if I'm not wrong. Then stem cell therapy, you give intralesional injection of autologous bone marrow stem cell is safe and effective treatment modality. If in your paper they have asked that which effective treatment modality you give, actually it is very important. It is actually autologous bone marrow stem cells. Autologous bone marrow stem cells. Okay, autologous bone marrow stem cells, very important point. Okay, but this is very important. So if you have any queries or questions, you can ask in the comment section.